Hi, I'm Kim. I'm going to be your nurse today. Can you tell me your name and your birthday?
Just say that you're going to start at.
How are you doing today? Today we're going to do your head toe assessment.
But I don't
Here, I'm washing my hands.
I just said below the clavicle.
Wash my hands, and
No, you got to go lateral.
I would have already taken her vital signs and assessed her gait. She's a steady gait and her balance.
Go ahead and go over here. I like listen to 2 extra breath sounds.
And by getting her to state her name and her birthday, and in general conversation, I can assess her level of consciousness, her speech, and any impediments that she may have. At this point, I'm looking at her face and her skin, also in the symmetry of her eyes and her ears. That is something that I can tell just by speaking with her without having to assess her. Can you tell me where you are while you're here?
I didn't say that.
Okay, so that makes her alert and oriented times 4. And I'm gonna start at your head. I'm gonna look at your hair, and here I'm just looking for anything, any blunts or bumps or any abnormalities. Hair looks good and clean. Ears look good and symmetrical. I'm gonna move down to her eyes, and I'm going to look at her pupils. And I'm going to come from the side, and I'm looking for her pupils to be equal, round, reactive to light, and accommodation. And you'll just follow my pen for accommodation, and then I'm going to check her peripheral vision with the 6 points. Follow my pen. Keep her head still, please. Thank you. Very good. Also checking for nystagmus. And I tested for EOM. Okay, from here I'm going to inspect her mouth. She'll open up wide. I'm looking at the mucosa, making sure it's pink and moist. And then I'm going to look in her nose, and the mucosa is going to be red. Okay, from here I'm going to move down to her neck, and I'm inspecting the carotid arteries, and I would also palpate for thyroid, checking for any abnormal lumps on the thyroid. Again, at every stage, I'm looking at her skin, and I'm looking for abnormal moles, marks, abrasions, bruises, anything that looks out of the ordinary. From here, I'm going to check her skin turgor. So I'll pinch the skin under her clavicle, and I'm looking for an immediate recoil. If not, it means she's maybe dehydrated. Okay, so from here, I think I'm going to listen to her heart sounds. If you don't mind, I'm going to have to touch your chest. So I will find my angle of fluid. I'm going to go down to the second intercostal on the right side, and with my diaphragm, I'm going to listen to the aortic region. Then I'm going to find my angle of fluid again and go second intercostal on the left side, and that is going to be my pulmonic region. Go down to the third intercostal, and I'm listening for the Erb's point. This is where I can hear S1 and S2. Go down fourth intercostal, and that's my tricuspid. And then I'll hit the fifth intercostal at the mid-clavicular line with my diaphragm. This is the apical or mitral. Here I'll listen for 1 complete minute. Then I will turn over with my bell, which is going to give me low, deep sounds, and with this I'm listening for murmurs in the same areas. Okay, sounds good. Right, and from here, I'm going to get you to go ahead and, I'm going to listen to her lung sounds first. Now we've done her heart, we'll do the front lungs from the front. And we'll start with the patient's right, and we're going to listen with the diaphragm, moving in a ladder motion. Here. I'm listening for any kind of crackles or wheezing or anything that sounds abnormal there. Okay, I can get you to sit up on the side of the bed, please. Okay, I'm going to just oscillate her lungs from the back using the same ladder pattern. Starting on the right. Also listening for one full breath at each spot. And I forgot to mention that I did listen for 2 complete cycles of heartbeats, 2 love doves on the heart sound. From here, I'm going to look at her arms, check her brachial and radial pulses on both sides bilaterally. I'm checking for capillary refill for 2 seconds. Okay, her skin is warm and dry and intact. And here I'm able to assess any pressure points, but my patient is not bedridden, so we really don't have to worry about that. So I'm checking the back of her neck, her elbows, shoulders. I'm going to get you to squeeze my fingers, keep her arm straight, push, pull. Okay, I'm going to go ahead and just test her leg straight while I'm here. Pull, push out. Okay, good job. All right, we'll get you to go ahead and lay back down. Okay, from here we're going to look at her abdomen. And so are you having any pain in your stomach today? Okay, so first we're just looking and inspecting, looking at all 4 quadrants. I'm going to listen with my diaphragm first, starting on the right lower quadrant. And I'm listening for vowel sounds. Right lower quadrant, right upper, left lower, and then the aorta. Then I'm going to flip around with my bell, listen to the quadrants again. I'm listening for cardiac sounds this time. The aorta. Then I'm going to lightly palpate each section. Not have any pain, which feels good. Alright, and from here, I'm going to go down to her legs. I'm also inspected the skin so far. I'm inspecting her legs for edema, so I'm going to push down and look for pitting in both legs. Checking both her pedal pulses bilaterally and capillary refill on her toes. I'm also going to inspect her heels for pressure sores and the backs of her knees. And then I would also check her backside for pressure sores. From here, we'll ask her if she has any questions about anything. If there's anything that she's hurting or needs help with, I will wash my hands and I will document. But I forget.